Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a presentation by Dr. Anika, a sleep researcher on sleep deprivation. You now have 90 seconds to read questions 31 to 36.
My name's Dr. Anika Shah, and my presentation is about chronic sleep deprivation, a topic that's both deeply relevant and widely misunderstood. And that probably explains why, among our patients, there's a lot of confusion about what constitutes enough sleep, how sleep debt accumulates, and why chronic lack of sleep can have such profound effects on both physical and mental health. To my mind, this largely stems from the cultural glorification of busyness and productivity, where sleep is often seen as optional or even indulgent. As healthcare professionals, we need to find a way to explain what chronic sleep deprivation really is, in simple terms, and why it matters, starting with the basic science. The science is clear: sleep is not a passive state. It's a highly active process during which the brain consolidates memories, clears metabolic waste, and regulates hormones. The body repairs tissue, strengthens the immune system, and balances energy levels. But when sleep is consistently cut short, whether due to lifestyle choices, work demands, or underlying sleep disorders, it disrupts these essential processes. Over time, this can lead to cognitive decline, weakened immunity, metabolic dysfunction, and increased risk of chronic diseases like hypertension, diabetes, and depression. We often talk to patients about the difference between acute and chronic sleep deprivation. Acute sleep loss, like pulling an all-nighter, can impair attention and mood the next day, but the body can usually recover with a few nights of good rest. Chronic sleep deprivation, on the other hand, involves consistently getting less sleep than the body needs, typically under 6 hours per night, over weeks or months. This leads to a cumulative sleep debt that the body struggles to repay. Using terms like mild, moderate, or severe sleep deprivation can help patients understand that the effects are not binary but exist on a spectrum. Sleep studies, actigraphy, and even wearable tech can help us assess sleep patterns and identify those at risk of long-term health consequences. One of the biggest challenges we face is that patients often underestimate the impact of poor sleep. Many believe they've simply gotten used to functioning on less sleep. What they don't realize is that the brain adapts poorly to chronic sleep loss. Reaction time slow, memory falters, and emotional regulation suffers, even if the person feels fine. This is especially concerning in high-risk groups such as shift workers, caregivers, students, and individuals with untreated sleep apnea or insomnia. These patients may not seek help until they experience serious symptoms like burnout, anxiety, or cardiovascular issues. That's why it's essential to screen for sleep issues during routine checkups. Asking about sleep duration, quality, and daytime fatigue can uncover hidden problems. In some cases, a referral to a sleep specialist or a polysomnography test may be warranted. Preventive medicine plays a vital role in addressing chronic sleep deprivation, especially as it becomes more prevalent in our 24/7 society. It's estimated that nearly 1/3 of adults don't get the recommended 7 to 9 hours of sleep per night. While some genetic variation exists, most people need at least 7 hours for optimal functioning. The causes are multifactorial, ranging from excessive screen time and caffeine use to stress, poor sleep hygiene, and demanding work schedules. That's why we need to start educating patients early, especially adolescents and young adults, about the importance of sleep. Sleep hygiene strategies like maintaining a consistent bedtime, limiting blue light exposure before bed, and creating a restful sleep environment can make a significant difference. And we can't ignore the role of mental health. Chronic stress and anxiety are major contributors to insomnia and fragmented sleep. Cognitive behavioral therapy for insomnia, CBTI, has shown excellent results in helping patients retrain their sleep habits and reduce nighttime rumination. Traditionally, behavioral interventions have been the cornerstone of sleep medicine. But in more complex cases, pharmacological and technological solutions are being explored. Melatonin supplements, for instance, can help regulate circadian rhythms in patients with delayed sleep phase syndrome or jet lag. More recently, orexin receptor antagonists, like suvorexant, have emerged as promising treatments for insomnia, targeting the brain's wakefulness pathways without the dependency risks of older sedatives. Wearable devices and sleep tracking apps are also evolving, offering real-time feedback and personalized recommendations. While not a replacement for clinical evaluation, they can empower patients to take ownership of their sleep health. Looking ahead, the future of sleep medicine may lie in precision therapies that target the underlying biology of sleep disorders. One exciting area is chronotherapy, timing treatments and behaviors to align with a person's biological clock. This approach is already being used in cancer care and mood disorders, and it holds promise for sleep regulation as well. Another frontier is neurostimulation, devices that use gentle electrical impulses to enhance slow-wave sleep or reduce nighttime awakenings. And finally, researchers are exploring the gut-brain axis, investigating how gut microbiota influence sleep through immune and hormonal pathways. As these innovations unfold, we must continue to advocate for sleep as a pillar of health, on par with nutrition and exercise, and ensure our patients understand that sleep is not a luxury, but a biological necessity.